Tonight, nearly 3,000 people in North Carolina are in the hospital because of COVID-19. 25% of those patients are in ICU and 14% are on ventilators. All of those patients mean more hours and more stress for already overworked medical providers. Note 11, CBS 17's Galat Malaman is digging deeper into the toll the pandemic is taking on those hospital workers. Galat.
Angela, COVID-19 is not the only hurdle hospitals are facing. There's also staffing shortages. The president of the North Carolina Nurses Association tells me he really started to see this uptick in cases right after July 4th. Acute care nurse Dennis Taylor says he didn't think he'd be in this position again. The state's 2,828 hospitalized patients, the highest since January 30th.
The one thing that continues to probably bother me the most is all the people that still don't believe that this thing is real.
The president of the North Carolina Nurses Association normally works with trauma patients at Wake Forest Baptist Health, now juggling multiple roles, including caring for patients with COVID-19.
You have to prioritize and triage what your job responsibilities are. In many cases, it means we're taking care of patients that we normally would not be taking care of, simply because there aren't enough providers to be able to do that.
As COVID-19 hospitalizations climb, Taylor says there's a statewide shortage of nurses. He says some hospital systems have about 700 vacancies.
We have physical beds. What we don't have are the staff to take care of patients that we put in those beds.
He says while the shortages aren't new, they are incredibly taxing on current nurses and leading to longer hours. He says changing PPE after every room, an added stress.
We're doing that literally hundreds of times a day.
Through it all, he says the most satisfying part of his job is being there for COVID patients when their families can't.
Being able to provide, I think that at least that human touch bridge for them is what's really most important.
Taylor is urging those who are not vaccinated to get the vaccine as soon as they can, a message that so many healthcare workers we speak with are sharing. Live in Raleigh, Galat Malaman, CBS 17 News.
All right, Galat, thank you. As COVID cases and the number of people in the hospital continues to go back up,